Welcome to Wellness Health Services, her Health Talks. I'm Dr. Joshua Derito, a family physician with interest in cancer prevention and disease prevention and also public health. Did you know that chronic leukemias are a common occurrence in the population? In this video, we are going to look at chronic leukemias. We are going to look at the global statistics. We are going to look at what happens that you get these chronic leukemias. We are going to look at the clinical presentation. We are going to look at how you can prevent yourself from getting these chronic leukemias. So, as an introduction, chronic leukemias are slow-growing blood cancers. They involve the proliferation of white cell count, which are cells that are involved in the defense mechanisms of the body. Unlike in acute leukemias, where the growth is very aggressive and very fast, the chronic leukemias are very slow growing. And the challenge is that cells are differentiated into all cell lines, but there is abnormal multiplication of this white cell count. The differentiation is there, but the growth is increased so that you have more of the white cell count in the bloodstream. There are usually two main types. We have the chronic lymphocytic leukemia and we also have the chronic myeloid leukemia. So looking at the global statistics, the chronic leukemias, they form about 35% of all the leukemia cases. Usually, chronic lymphocytic leukemia is the most common adult leukemia, especially in the developed countries. Chronic myeloid leukemia forms about 15% of all the leukemia cases in adults. And you have, for the chronic lymphocytic leukemia, about 5 in 100 people will get it. And for the chronic myeloid leukemia, about 2 persons per 100 persons get it. The modern treatments highly improve the survival in this type of cancer, especially that you have seen they are very slow growing. Chronic lymphocytic leukemia, what are the risk factors? One, advanced age. As you get more in age, around the age of 65, your chances of getting it increase. Family history of cancers. Being male is also a risk factor. Possible exposure to some of the agricultural chemicals are also risk factors. For the chronic myeloid leukemia, exposure to radiation before from either previous cancer treatment or people who work in high radiation environment are at high risk, and there is no family risk factor in this cancer. Usually for a chronic lymphocytic leukemia, there is a dysfunction in the lymphocyte proliferation, and there is a abnormal defense of the body because of the abnormal cells. In the chronic myelocytic leukemia, there is what we call BCR-ABL fusion protein, which is associated with the, what is called Philadelphia chromosome, which causes abnormal proliferation of cells of the myeloid lineage, increasing the number of these cells, leading to cancer development. What are the clinical features in this cancer? These include fatigue or tiredness, you have night sweat, you have unintentional weight loss, you may have an enlarged spleen, you may have lymph node enlargement. There is a high risk of infections, especially in chronic lymphocytic leukemia. There is increased bruising and bleeding, especially in chronic myelocytic leukemia. And in the advanced stages of the disease, then you may have bone pain and also reduced red cell amount, leading to anemia. The chronic lymphocytic leukemia staging is usually staged from stage 1 to 4, depending on the level of the white cell count and also the organs involved. For the chronic myelocytic leukemia, you have a chronic phase where there is a slow growth of the cells, and sometimes this type of anemia can change and become acute, whereby there is increased proliferation of the cells, and when it changes to an acute form, then the cancer becomes very aggressive and life-threatening. So what are the treatment? For the chronic lymphocytic leukemia, there is room for watchful waiting. What this means is that not all people who have the chronic lymphocytic leukemia get complication. And so you may just observe the individuals, you are observing them for the number of white cell count they have, the level of anemia, the level of the platelets, the symptoms that they have. And if the symptoms are bearable but not life-threatening, then follow-up is indicated without any interventions. Then, of course, if it reaches a stage that they need treatment, then chemotherapy is the mainstay of treatment. For the chronic myelocytic leukemia, then tyrosine kinase inhibitors are used for the treatment. And you may also have stem cell transplant for those cancers that are complicated. So what are the complications encountered for the people who have chronic leukemias? One is infections, because the white cell count formed are many but abnormal and function abnormally. We can also have what we call the Richter syndrome, whereby the cancer becomes aggressive and it turns into a form of lymphoma. You can also have blast crisis, where this is whereby there's a marked increase in the abnormal cells in the bloodstream, causing stasis in the red blood cells. And this can cause complications like bleeding in the retina, can have complications in the brain, and you may also have generalized body infections. Then you can also have treatment-related toxicities, whereby this one of the commonest complications of treatment is what we call tumor lysis syndrome, whereby there is an increase of these cells in the body, and this leads to clogging of the blood stream, and this can lead to kidney failure. The treatment is hydration, especially during the time of the chemotherapy, use of some drugs to help excrete some of the byproducts of the breakdown of these cells, and of course the maintaining adequate hydration for the patient. So for these cancers, there is no recognized preventive measures, because there are no obvious risk factors, but there are some things are necessary, like avoiding unnecessary radiation. For those people who need X-rays, it's always advisable to only do them when necessary. For people who work in where there is radiation, then personal protective clothing is very important. Also, those who work with some of these chemicals, using protective clothing is very important. Of course, monitoring high-risk populations, as we have seen, and then also promoting early screening and diagnosis and the treatment. So chronic leukemias are slow-growing, but they can also affect our lives. So modern therapies are offering life or hope for long survival, and the preventive strategies focus on risk reduction and the early diagnosis. Thank you for watching. Please subscribe for more content, and keep watching.